Morning.
Good morning.
How are you?
Good, how are you?
Good. I'm concerned about Mr. Kratny's urine output. I have been watching his lab values. He has a history of kidney disease. I would like to place a Foley catheter so we can keep a close watch on his intake and output.
Understood, Dr. Said.
Okay, let's go tell him.
Okay.
Good morning. How are you feeling today, Mr. Kratny?
Fine, Dr. Saeed. Just waiting to go to therapy.
I have been watching your lab values closely and I would like to make sure your kidneys are making enough urine. I'm going to be ordering a Foley catheter insertion for you so that we can accurately measure your urine output. Nurse Jamie will help put that in for you.
Oh, heck no, Dr. Saeed. I do not want to be putting a Foley catheter in his body.
Mr. Creatinine, I know it sounds like an awful procedure, but I promise you, I will be as gentle as possible and it will all be over very quickly.
Nuh-uh, no way.
Mr. Kratny, I understand your hesitation, but I want to make sure you understand how important it is to strictly measure your output, considering your history of kidney disease. A Foley catheter will help us accurately measure your output. If we don't place the catheter in, we won't know how much urine your kidneys are making.
Thank you for explaining that to me. However, I know my patient's rights, and I do not want to do that treatment. I will do whatever I can to measure my urine precisely without the catheter.
Understood.
As a patient, Mr. Creatinine has the right to refuse treatment to the extent permitted by the law, but should be informed of the potential consequences of his actions. Dr. Syed and Nurse Jamie did a great job explaining the situation to Mr. Creatinine. However, when the course of treatment is no longer needed, the decision isn't always up to the patient. Sometimes, protecting a patient's health may supersede their right to refuse a treatment that is no longer clinically necessary.
Miss Cotty's condition is also improving. Let's get that Foley catheter out today so that we don't cause her a secondary infection.
Sounds great, Dr. Said.
Let's go tell her. Good morning.
Oh, hello, Dr. Syed. I'm feeling so much better. The treatment you prescribed must be working.
I am so glad to hear that, Mrs. Cotty. I have good news for you. You are doing so much better. You don't need that Foley catheter in place anymore. We are going to be removing that today.
Does that mean I have to get up out of bed every time to go to the bathroom now?
Yes, Mrs. Cotty, but we will help you with that. Just press the call button and we will be sure to come and help you right away.
I don't want you to take it out. I'm not ready. No way is this catheter coming out today. You can forget about it.
Mrs. Cotty, while I understand how reassuring it is to keep the catheter in and you're nervous about going to the bathroom, I need you to understand how harmful it is to keep it in longer than it needs to be.
The catheter can actually cause you a very serious infection and a much longer hospitalization. You are doing so well, you don't want to take any steps backwards.
Nurse Jamie's right. Now that your condition is improving, the risks no longer outweigh the benefit of having a Foley catheter.
I promise, Mrs. Cotty, we are here for you and we will help you get to the bathroom. Now let's get that catheter out and keep you on the right road to recovery.
Oh, all right, I understand. Thank you for explaining this to me.
Of course.
We always ensure the rights of our patients treated at Gaylord are protected. Upon admission to our hospital or outpatient centers, all of our patients are provided information which highlights patient rights and responsibilities. All entities of Gaylord have many functions to perform, including the prevention and treatment of disease, the education of both health professionals and patients, and clinical research. All these activities must be conducted with an overriding concern for the patient and, above all, the recognition of their dignity as a human being. Patients have the right to refuse treatment such as placing a Foley catheter. However, when a treatment is no longer clinically necessary, it is important we educate the patient on reasons why and help support them in their understanding. Remember, it is critical to include the patient in their care and treatment decisions and to also educate them regarding hospital-acquired infections by explaining the risk and benefits of accepting or refusing treatment.
Oh, all right, I understand. Thank you for explaining this to me.
At Gaylord, our number one priority is to keep our patients safe and reduce the risk of CODI and other hospital-acquired infections.